again, everyone. Here, this is Subrat by Nipati, and I am the non-invasive, drug-free pain expert. Today, I am going to talk about mostly headache. And this is a question I get a lot. Not only that, most of our patients we treat here in our clinic, almost like 90% of them, as you know, many of them are women. And they have a complaint of headache. And most of the pain they're complaining about headache. It is pretty excruciating. Sometimes it is so excruciating, I don't have to tell you if you are suffering. They feel like they just cannot do anything anymore. They just have to go and lay down and do nothing, don't want to talk to anyone. Just the joy of life is pretty much, it is gone. And the second thing that happened, I have certain group of patients, they complain of so much of headache. They say, well, I rather die than suffering with this kind of headache. And this is exactly what I am going to talk about, because though people, they may not die because of headache, not like heart attack, you'll be jumping up and down, and it can be pretty much disabling. Most of the people, they suffer, or if you are suffering, you are watching this, you know it very, very well, that what really happens when you got hit by a headache. And then headache is not only just one thing, it can come with different frequency. Some people get the headache in a month, some people get it every week. And I know many people, actually they are pretty young girls. I was seeing another one, actually a few days back. She has a headache almost every alternate day, almost lasting for 2 weeks in a month. So this is why it is very important, as I always try to make people more and more understand, because once you understand and your knowledge, that is going to give you power. So without that, you'll be running around without finding any solution. And the problem, what really happens when you have a headache, you go to your physician and they will be probably pretty quickly, they're going to diagnose you like a migraine. And I know many of our patients, they're taking migraine medication for last 5, 10, 20 years. And still they're having headache. Now why that is? That is exactly what I'm going to explain. Or if not migraine, medication is not working, they are going to give different kind of injection up to, I know people, they take Botox injection, which they give it almost every 6 weeks. Forget about the money. It is quite dangerous to take a neurotoxin, which is the Botox toxin, to take care of your headache. And even if between the injection, they will have severe bouts of headache. So that's what I am going to explain to you today. So headache, usually it defines if your head hurts, of course we call that as a headache. But the peculiarity of headache, it is like that. So sometime you may not have a headache full blown. It might feel like your neck is tightening up and slowly the headache is going to come to you. That can happen there too. So broadly, let's divide. So I'm not saying that migraine is not real. Yes, migraine do happen. And migraine, what we call, it is called a vascular headache. So what does that mean? There is something going on in your blood vessels, which your brain or your head is full of blood vessels. There's something going on with that. Either it is dilating or constricting. I don't want to make things more complicated, but I will say you this much. There's something going on in the blood vessel. When the changes that happens, then you have migraine headache. And also it has a lot of other symptoms goes along with it. So migraine is a vascular headache and it changes with the blood vessels, like your arteries or your vein. Some changes are going on and that triggers the headache. So what really happens, yes, migraines are real, but they are very, very kind of rare. Though you will see left and right people getting diagnosed, and the problem with the diagnosis, not with the migraine. So yes, migraine is real. So when the migraine headache happens and somebody diagnosed you and you take the medicine, and if it is a true migraine, your headache goes away completely. So when you have a headache, you take the migraine medication, your headache goes out completely. If your headache is not going away completely and you still continue to have headache, or maybe your headache is less but is not completely gone, that is probably it is not migraine, or it is another kind of mixed kind of headache. So let's recap again. So the headache are not always equal. Not all headaches are equal. It is different, and it can have different kind of triggers. So I'm going to talk about triggers, maybe in this video, maybe video down the road, but it is very important for you to understand. So we can now divide headaches maybe because of some organic causes. Organic causes are real and it can be dangerous. So it is a good idea, any headache you have, if it is excruciating and it has added features, like there is a change in vision, there is a change in your mood, there are other kind of, like something change going on in your skin, sweating, any other kind of thing, it can be serious. And imagine you never had a headache in your life and suddenly you had a headache. It could be kind of gearing down, something serious is going on. So it is a good idea to check yourself out with your physician. Sometime you might have to go to ER because it can be a sign like that. It can be intracranial pressure is going on, like you might have a stroke, you might have a aneurysm which is busted, that is maybe some kind of infection which is getting into your brain. So that could be a whole lot of things can be going on. So they can rule out, or that can be treated. But this kind of condition is extremely rare. Or you can have a high blood pressure, suddenly your blood pressure go high, through the roof, or your thyroid is acting up. So any kind of these real issues can happen. So how do you know, like you have no headache, or you never really had that much of headache and suddenly your headache is went high up? So it's a good idea to get a medical advice so that you are not missing anything, and it can be extremely life-threatening. But these kind of conditions are very, very rare. But it can happen. So it's good to check it out. So in this video or video down the road, I am not talking about those kind of who has a kind of a real cause which you can detect through an MRI or through an X-ray or a blood test. You can figure that out. Your physician can figure that out, and that you're going to get treated for that and your headache is gone. I'm not talking about that. So I'm talking about the other, which is 98% of the time. So in the other kind, you have basically two varieties of headache. Number one is vascular. I talked about that already. It is migraine. And the number one, which is a musculoskeletal headache, which happen most of the time, 95-96% of the time, all of the headache are musculoskeletal in origin. I am going to cover that in this video or the video down the road. So if you are new here, again, I'm a physical therapist. My name is Subrat, and I'm doing this for last 30 years. So I love to educate all our patients and anybody who is watching. So you have friends and family, try to share this video, because if they will hear all these things, they know exactly what to do, or they can go for the right help. So please like, share, and forward this video. It doesn't matter what platform you are watching. It can help your own friends and family. So I was talking about musculoskeletal headache. Now, many of you probably know, you've been told in different name, is sometimes called as a cervicogenic headache, comes from your neck, or it can call as a stress headache, or it can call as a, there are many different names you probably have heard, but no matter what name you know, those are all come under the same umbrella. We call it as a musculoskeletal headache. So it is coming from your muscles as well as from your skeletal condition. So that is the most important thing for you to remember. So basically, I talked about three different variety of headaches. Number one has real causes. So it can be ranging your high blood pressure, or something is off in your blood chemistry, to a stroke. That is serious, that is dangerous. Get yourself checked out. Number two is vascular, coming from your blood vessels, which is migraine, and that is where the medicine works the best. And the third, which is most in the bulk, which is called as a musculoskeletal headache. So anybody is watching this have chronic pain. I don't care what chronic pain you have, like it can be fibromyalgia, chronic fatigue syndrome, and maybe you have a back pain, or maybe you have this headache, or you're having headaches off and on for a long time. It is 100% that it is a musculoskeletal headache. And many musculoskeletal headaches are very, very common, again, in women. So if I will divide the headache population, only 1/4 will be male population, and almost like 3/4 are women. So if you are a woman, your chances of having headache is 4 times more. And the chances of you are having musculoskeletal condition headache, because for musculoskeletal, is almost like 80 to 90%. So it is a huge group. But when it is from musculoskeletal condition and you treat that with medicine, it does not matter you are taking gabapentin or you Botox injection or any of these things. So that usually does not work. And that is exactly what I'm trying to explain. My subsequent videos, that how musculoskeletal headaches are different and how that can be treated and what can you usually can do. Because medicine, obviously, it does not work. If it works, it has a lot of side effect and it creates a lot more problem than solution. And thank you so much for watching this video. I'll see you next time. Bye.